that now is working on coronavirus. And I will emphasize firstly this. What we know before this pandemic of COVID-19. And certainly, if you look at the kind of another that we call numeric analysis, we can see that certainly there was not too much research performed on coronaviruses before 2002 when the epidemic started in China. And a similar trend was also observed later for MERS. During the epidemic, a lot of research is done, and really in the past 3 months, many aspects of these diseases became out and is available in different terms. Nevertheless, our terms coronaviruses were a matter of concern, as we discussed in previous meetings at the WHO, like this one, in which I participated in 2019.
Professor Alfonso, the voice is not very clear.
I don't know why. Because I am using the mic of the computer. Now it's showing of failure.
Go ahead, please.
Okay, I will continue. I will continue. As I was mentioning, this has been a matter of concern, and this has been discussed of not only for coronaviruses but for other emerging diseases and re-emerging diseases. In this report we developed with WHO a couple of years ago. And certainly there is a lot of concern in different aspects of disease, not only epidemiology, transmission, but also clinical events, especially even including risk groups that now, for example, here in Latin America, we are seeing, such as is the case of special groups, such as the pregnant women, for example, immunocompromised patients, patients with diabetes, etc. Very quickly, as you know, and this is important also for the rationale of what we are doing right now here in Latin America, the epidemics certainly began in China and expand to many other regions in the world. And curiously, Latin America was the last region in the world to receive imported cases of COVID-19, beginning in Brazil, but later in all the different countries across the region. Right now, as we have been discussing in different publications, we have COVID in every single country, especially in South America, where in Brazil we have thousands of cases that, in fact, we have right now around 10,000 cases in between Central and South America. And of course, if you consider in the Americas the situation of USA that has been already discussed, this is an important situation. In my country, here in Colombia, we have right now more than 500 cases. But fortunately, till now, we have most cases occurring, especially in young population, as you can see here. And this is important regarding the fact that these people has been mainly, as you will see here, more than 92% isolated at home. And these patients are completely different of most that we have seen in the literature, because these have not this evolution of this kind of presentation. And certainly right now, many cases, but not only, isolated cases like this we published with people in Nepal that also Ali has been already mentioned, had been already published in different journals, and many case series and many observational studies have been describing, especially the clinical features and also the laboratory findings of these that have been published, for example, in Lancet, in New England, in describing the clinical feature, the imaging features, among many other things. So regarding the systematic reviews, well, we had a new disease. Then this implied multiple implications in the need of knowledge in trying to synthesize and to summarize information regarding epidemiological aspects, clinical findings, diagnostics, therapeutics, prevention, and also these will lead to understand the usefulness of systematic reviews with or without meta-analysis in order to synthesize or summarize information regarding the different clinical aspects. Remembering that, especially for the case of systematic reviews of experimental studies, these are in the top of the hierarchy of evidence, as has been discussed for decades in the world. But certainly we can not only develop systematic reviews of clinical trials, but also from observational studies, as I will show. And what is a systematic review? Very briefly, it's a review in which there is a comprehensive search of relevant studies on a specific topic, and those identified are then appraised and synthesized according to a predetermined and explicit method that can lead to reanalyze data, to meta-analyze data, and provide new results that combine all the published information we have on a specific topic. And we can also add a concept that was published in this dictionary of epidemiology of the International Association of Epidemiology, that a systematic review applies strategies that limit bias in the assembly, critical appraisal, and synthesis of all relevant studies on a specific topic, and are different from traditional reviews in which these do not involve a systematic search of literature, and also will be a base for recommendations, for example, based in the GREAT guidelines. That this is right now very important for countries that are actually developing different guidelines. And recently here in Colombia, we published our national guidelines or consensus about healthcare for more than 200 clinical questions that were developed according recommendations of our experts based on the GREAT qualification in different topics. But this is for the national scenario, but certainly others right now in the region are underdeveloping, such as is the case of the Pan-American infectious diseases, where I am coordinating the development of the Latin American consensus of healthcare for COVID-19. I will not stop on this, on the methodology, but certainly right now, after almost 3 months of investigations on COVID-19, we have systematic reviews, more than a dozen of different systematic reviews that cover these different topics: epidemiological aspects, clinical manifestations, comorbidities, laboratory findings, imaging patterns, complications, outcome, including case fatality rates, as well as prevention. Certainly, I will begin with this first, that was available on 25 February, and this was an initiative from our research group, even in a moment that we were not presenting yet cases here in Latin America. We were at that moment in the phase or stage of preparedness, for the arrival of COVID-19. And certainly we developed this with the support of the collaboration of multiple people, not only here in Colombia, but in other countries, even in China, Nepal, Japan, India, as well also Dr. Ravan in Saudi Arabia and other countries here in Latin America. And we try to collect all the studies that were available in order to see what was happening with clinical, laboratory, and imaging feature, especially clinical and laboratory. And after that, other systematic reviews have came out about this. We published this in Travel Medicine and Infectious Diseases, and so long has attracted some attention because of the relevance of the data. And if you're interested, you can also follow me, because I am sharing this kind of publication we are performing with the international and national collaboration. Which are the main findings that we have through this systematic review with meta-analysis? As is expected, the patients present with fever in more than 80% of the cases. And we have here a difference that I consider important, and I will be complemented with another systematic review, which is the case of fever. 92% of adult population presented, 43% of children presented, and this difference in terms of the confidence interval is different. So the children present less fever than adult. We are talking, of course, of confirmed cases of COVID. Regarding cough, is similar, 63% and 22% of children compared to adults. But here, there's an overlapping of these confidence intervals. Nevertheless, for children, we have less studies than for adults. These patients require not only hospitalization, but in these studies, 20% of them require ICU in a confidence interval of 10 to 30%, presenting more than a third of them comorbidities such as hypertension, cardiovascular disease, diabetes, COPD, malignancies, and chronic liver disease. Other clinical manifestations that we seen in these studies is dyspnea, myalgia, or fatigue, sputum production, sore throat, headache, and diarrhea. But see here the frequency of them. Right now, in certain countries such as Germany, UK, and even here in Latin America, we are looking right now at shifting in certain clinical findings, such as is the case of anosmia, dysphagia, and especially also headache. And this should be also be considered in the next clinical studies, and maybe in future systematic reviews regarding clinical findings. Regarding the laboratory findings, I would like to highlight that from these studies, 75% of the patients in this combined prevalence present decreased albumin, and also a high C-reactive protein, LDH, among other hepatic alterations such as AST, ALT, creatine kinase, also that has been very highlighted. In this case, 43 of the patient presents lymphopenia, and now we have to consider in the future to meta-analyze CD4 and CD8 results regarding this. The ESR, the erythrocyte sedimentation rate, leukopenia, also in this proportion of patient leukocytosis, high bilirubin, high creatinine. And in our systematic review, we include also the imaging findings, but at that moment, there were not enough studies like now, and I will present other systematic reviews that focus specifically and only on that. But certainly, most of the patients present bilateral alterations in the imaging, with no significant difference on this between adult and children, and the pattern of the ground glass opacity was also very common in these studies. Regarding complications in our meta-analysis, we found the anemia was also detected in a significant proportion of patients. The IRDS in third of the patient, acute cardiac injury, acute kidney injury also, and also shock, secondary infections. Most of these the patients in these studies that require healthcare require also hospitalizations. And from this study, 52% of the patients were discharged, was reported on them, and 13 of the patients have a lethal outcome with a confidence interval between 6 and 20.5%. We also analyzed in our meta-analysis case reports, and the case reports findings were consistent with we had in different other kind of observational studies, and you will see this in the full report is already online. Other similar systematic reviews, like this one, published 3 days later in the Journal of Medical Virology, also shown certain things. This is very briefly in the text, in the introduction, and the methods they provide in the paper. And certainly they focus in the clinical findings too, such as fever, such as cough, and they found similar results. 89% of the patients with fever, 72% with cough, myalgias or fatigue, 42%, and regarding complications such as IRDS, 14%, also certain things of the imaging, such as the abnormal chest CT, 96%, patient in critical condition, very similar to us, 18%, we found 20%, and regarding the fatal outcome, they found 4.3% in a range from 2 to 6%, which is certainly something similar to us. In these systematic reviews, they focus on comorbidity, and this and the last were also from China. And regarding the comorbidities, they present that most patients present some kind of...
2 minutes, Professor Alfonso, please.
Thank you very much. They present 17% hypertension, 8% diabetes, cardiovascular disease, respiratory system disease, 2%, and they did not assess other clinical manifestation nor laboratory imaging. There are other also for comorbidities, such as this, which is very consistent, regard hypertension, cardiovascular disease, the smoke, they also include, and there is another that made this also, which is not too much, around 8%, diabetes, kidney disease, malignancies, COPD, and this one that was recently published in Tobacco-Induced Disease Journal from the group of Harvard Medical Schools that only made the systematic review, but not on meta-analysis, also described the importance of this, making such comparisons, but not significant in most of the studies regarding smokers and no-smokers. And also there have been certain systematic reviews focused specifically on imaging findings, such as this in the American Neurology Journal. And they found this, that more than 80% of the patients have certain kinds of findings, such as bilateral involvement, peripheral distribution, ground glass opacification, and a third of them consolidation. This recently published in Acta Pediatrica and Scandinavian Journal also described a systematic review of children, finding that they present less symptoms than adults, but certainly they did not meta-analyze the data. They described also that children below 20 years old have not yet described as a risk group, for example, for fatal outcome, and they describe certain recommended treatment, but not based on the synthesis of data provided for meta-analysis. Other systematic review made some inclusion of the qualitative information of diagnostics and treatment. And certainly treatment is an important matter in which we had not yet a relevant synthesis of data that will be available because there is a lack yet of clinical trials on different potential intervention, including antivirals, such as this case of chloroquine, and systematic review.
1 minute, Professor Alfonso, please.
Thank you, I'm finishing. And of this, that only provide, for example, the number of clinical trials that are under development. These also are similar. I will not stop at these. These are also similar systematic reviews that apparently are systematic review, but in fact are more narrative review, describing certain information regarding a systematic analysis of the databases. And this was published on February. This is one of the last that it describing the comparison between effectiveness of N95 respirator compared to surgical current mask against influenza, but describe the implications right now on coronaviruses. I invite you to check this at BMG, best practice, that is analyzing also this, including what is found in the literature, but it's actually not properly a systematic review. For conclusions, and this is my last slide, systematic review so far provide relevant information on different aspects of COVID, helping to synthesize data and information of importance for evidence-based decisions. But nevertheless, more systematic reviews are needed as more studies are also emerging. On observational, certainly we have certain aspects, but there are new aspects that we need to consider. For example, I mentioned some neurological findings and new complications. But for experimental, we need to keep an eye on new RCTs that are being published. Everybody knows that the results of the New England RCT on lopinavir and ritonavir, but certainly we need more data to base decisions on that, and also when available will be also useful systematic reviews on trials, including also vaccines. And this is my last slide, and certainly I think coronavirus have posed a challenge for the global health governance, and I would like also to invite to consult this and to consult our publications on the net on langcovid.org. And thank you very much for the opportunity to present this. And I would like to finish with this phrase from Colombia here in Pereira, that in Pereira there are no foreigners, we are all Pereirans. And after this pandemic, you are invited to visit the coffee triangle region of Colombia, a place for the best coffee in the world. And thank you very much for the attention.